One of the most requested sessions that people participate in or comment the most on that's available at the conference is the date with the doctor. It gives people an opportunity to talk to some of the top practitioners addressing CVS, and it's a huge opportunity. So what are some recommendations that you might have for people to be like the most prepared for that?
It's a great question. I am very happy to participate again in the patient conference. I think this date with the doctor, it's a really great opportunity to hear a lot of stories from patients and for me to kind of get some information to people in a pretty quick way. Hopefully it's not an intimidating thing. This is meant to be a really casual, just kind of discussion of someone's care. And I think what will help us as clinicians help you when you're discussing your case is to give a couple of key things. So first of all, maybe the length of number of years that you've been having symptoms, just simply giving that number, and trying to figure out how many times a year you've been having attacks, and whether that's increasing recently or about the same. Those are things that are really helpful. And then kind of giving a sense of what medications have been tried before, whether those are abortive medications, so something to use in the moment to try to turn a cyclic vomiting syndrome attack off, as well as perhaps if you're in the right kind of category of illness, if you've used prevention medicines before, prophylactic medications. So simply knowing I've had cyclic vomiting for 8 years, it used to be 5 times a year, but now it's more like 10 times a year. I started on a medication like nortriptyline and it didn't seem to do anything. What else can I do? I should also add that one other feature that would help clinicians give you some guidance is knowing how frequently you had to go to the emergency room or even been hospitalized. The length of your typical attack, for example, is it typically 4 days long, half a day long, 7 days long or more? Something like that would help us as clinicians really help you as a patient.